Globally, adolescent girls and young women face gender-based inequalities, exclusion, discrimination, and violence, which puts them at increased risk of acquiring HIV. With a fragile health system, a struggling economy characterized by high inflation rates, high rate of unemployment, closure of companies, a thriving informal economy, and pervasive social cultural stigma and discrimination. Zimbabwe in particular is not spared from the above phenomenon.
Sesu vana vasikana vechidiki tikusangana nematambudziko akaita sekuti kana tiri kumaperiods tikushaya zvinhu zvekushandisa like mapads. Izvi kuzokonzera kuti sevana vechidiki tizoita indulge in maactivities ekuti anozopinza matambudziko, like tinenge takuenda kuti tinonotsvaga mari in a way kuti tinenge takurara nevarume, then zvinozokonzeresa problems ekuti tinenge takuwana ma-STIs, izvo zvinova zvirwere zvepabonde.
Kwedu kunoitwa zvemining nomainwa gold. Saka ukachiratidzwa tumari ngaona bhebhi ndine mari chichi magrade 7 utano vamwe vakatoroorwa kuita vekusekondari ndo vakati one day so kutoti vakawandisa vachiona vana vadiki vari mumamarriages
anadhedha vari kudya vanhu varimi vanoti because vasikana kuti tinochida kushanda kuninda kuya chichi and you realize kuti ndo tinotoshanda kakawanda zvazvakuzachi vana vekwakati ndo vari kushanda but varimi vacho ndokutengera foni ndokudii chichichi tostaura edu zvemakorokoza nezvimwe zvese izvo but madhara ndo vari kunyadza because handi kunokwa kune vanhu vanotorima zvekuti vanoita famous kuti baba ninge vane mari kana kuti vakazospenda kwakati kana kuti chii sikairara vamwe ndo vanenge vachi unotoreva kuti uyu ane nhamba dzavo uyu anadzo vanenge vachinetsa vanhu.
Vamwe vari kupiwa nhumbu, vapiwa nhumbu vanogona kupana nhumbu vachiwirirana nditi, then uyu akazomudza kuti ndane pamuviri munhu yanovhaira apa nhumbu, saka vazhinji nhumbu dzachobvoita sei obva vabvisa vakabvisa hazoenda kuchipatara. Vamwe vanoti ukapiwa nhumbu ukabvisa nhumbu anti unoklinwa chibereko, vanobva havazoendi kana kuchipatara kwacho, vanobva vangogara vakabvisa nemishonga yechibhoyi vanobva vangogara. Ndiri kunyanyotika kazhinji
vari kusangana nemadzimai edu echidiki vari kunyimwa mari nevarume vavo, vari kurohwa, vamwe vacho vachishungurudzwa vachitoramba nenyaya yekuti vanenge vasina zvokuita, havasi kushanda. Vanhuwo kuti kuchikoro havana kuenda, vazhinji vemuno havana kuenda kuchikoro.
To address some of these issues around continued gender-based inequalities, exclusion, discrimination, abuse, and violence against adolescent girls and young women, Katso Sisterhood, in partnership with the Youth Engage, introduced the Simba Utano project. The project, which is being implemented in Mazoe, Seke, Umkuza, and Goromonzi, seeks to address demand, supply, and structural challenges around access to information and services related to sexual reproductive health and rights.
We have trained what we call community facilitators, 30 community facilitators in each district. These community facilitators will reach out to 10 people. Then they sit down from what we call the Pachoto, where they sit down and discuss about SRHR, they discuss about GBV, they discuss issues about HIV and AIDS, STIs. They meet once a week, so in a month they meet four times. Then Katso Sisterhood and Youth Engage, we go at the end of each month to assess and to hear their stories and to hear their progress, how the challenges that they have been facing while they were discussing these issues. We have strategized to use this model so that they feel free to talk about their issues when they are alone.
Our main focus for Simba Utano has really not been on the knowledge-based approach only, but we are also looking into ensuring that adolescent girls and young women also have access to services to sexual reproductive rights services in their communities. So on a continuous basis, what we usually do is we bring mobile clinics to them where they access services on STIs, HIV testing, family planning, whatever that affects adolescent girls and young women. That is the services that we provide to them in their communities. But we do not do this on our own as youth engaged in Council Sisterhood, as we do not really have the capacity to provide the expertise of nurses and doctors. So we work in collaboration with our hospitals, local hospitals in the districts, and we ensure we have the DNOs helping us, the DACs helping us, that is the district aid coordinators, to bring together health workers, the nurses and the doctors, but mainly it's nurses, because in most cases doctors will not be there, but we'll have nurses on the ground who will be offering these services like counseling as well.
This is peer-led model where these peers are going to also come up with their caseloads, where they are going to train their peers in terms of adolescent sexual reproductive health, HIV and STI. Given the wards that they are operating in, which are hotspots, HIV hotspots, we believe that after this training and after this model implementation, we are going to see, first and foremost, reduce the number of teenage pregnancies in the district. We are also going to realize reduced number of STIs among youth and adolescents, and also we are going to have a reduced HIV, new HIV transmission, and also eventually reduce our prevalence rate in terms of HIV.
The ultimate outcome of the Simba Utano project is to improve the health of adolescent girls and young women at risk of HIV, thereby contributing to Sustainable Development Goal SDG number 3, which is on good health and well-being. The project will utilize proven effective strategies and evidence-based best practices to increase the utilization and access to sexual reproductive health rights, information and services, and ultimately curb new HIV infections.
Now that the adolescents and young people have the information, they're fully aware on how to protect themselves. We're going to facilitate platforms where they're going to engage with GDPRs and at national, at district, even at local level, on ensuring that the gaps that they have in terms of accessing services, in terms of their rights being protected are addressed. We had issues like child marriage coming out. We had issues like lack of access to education, which are coming out from the young people. So moving forward, we want to, for the young people themselves, to actually have a face-to-face with GTBS and local leadership and at national level as well, so that those issues are addressed.
What we need to see is a force of young people who are healthy, who can make healthy, informed decisions over their lives, so that they can also make contributions in the development sector of Zimbabwe. That is our hope and wish. And Impela, we also incorporate the Impela Nkatle Ngamandla. We have always talked about language barriers and within our programming, to say we need to also put in Ndebele, we need to incorporate all dialects so that we reach all adolescent girls and young women within Zimbabwe. Also, not forgetting the boys, who are the adolescent boys and young men who are our champions, our male champions that we'll be working with in the context of Simba Utano.